patient completely inside the body bag, like so. If no other family will be visiting the patient, then it will be okay for you to take the tags so that you can properly identify your resident. You want to make sure that the tags have the proper label and that the nurse has verified that the correct labels are on the tags. Once you have collaborated with your nurse, she will determine exactly where you need to place the tags on the resident's body, if you need to do so, or if you're going to place those tags on the outside of the resident's bag. If family still needs to visit, once you have the resident inside of the bag, like so, you want to reposition the bag over the bed as if it was a sheet. You want to tuck the bag around the edges of the bed. Like so. Then you want to make sure that you bring the residence covers back up to the top of the bed. You want to remember to maintain her privacy while you are doing so. I'm going to take my bath blanket and place it to the side. All right, Amanda, on the count of 3, I'm going to lift your head up. 1, 2, 3. All right. I'm going to work on her presentation so that the family can still have a visit with their loved one. Gently elevate her head, lowering her head. I'm elevating her head and lowering the bed. Now Amanda has received her last visit and it's time to position her body inside the body bag, place the tags on her body and on the bag. So now I'm going to elevate her bed and get her placed completely inside the body bag. All right, Amanda, I'm going to elevate your bed to my waist level, and I'm also going to lower your head. All right, on the count of 3, I'm going to lift your head up. 1, 2, 3. I am going to take the edges of the bag and bring them off of the bed. She is already inside of the bag, as you can see. If you look at the top of the bed, once we bring the bag, the edges of the body bag from the corners of the bed, she's already positioned inside of the bag. We're going to provide her privacy and place her inside of the bag. You're going to take the tags and place them on her body according to the policies and the procedures of the facility that you're working with, you're going to have to place one of the tags on the outside of the bag as well. So these are the tags. You're going to place the resident sticker on the tags. You're going to allow the nurse to verify that you have the correct stickers on the tag. One tag will be placed on the body and the other tags on the outside of the bag. So we have placed our resident's label on the tag. I'm going to place this tag on Amanda's toe. I'm going to expose your foot temporarily. And as you can see, her feet are already on the inside of the bag. I'm going to place the tag on her toe, like so. I'm going to take the edges of the bag from under the bed, and I'm going to roll it over her toe under her top linen. All right. At this time, I'm going to step over onto the other side of the bed and bring the other side of the body bag to the point where I can completely zip it. This side of the bag, I'm going to fan fold her covers over. I'm going to bring the edges of the body bag to the center of her body. At this time, she is completely inside of the bag. You can see the last thing we need to do is to zip up her body inside of the bag. So you're going to zip the bag. And where the two zippers meet, you're going to apply your tag. Each facility may have a particular way in order to apply the tags to the outside of the body. You will follow the policies and the procedures for the facility that you will be working with. So I'm going to secure this tag at the point where the zippers meet. I'm going to place her covers back over her. This is what she looks like once she is completely covered in the bag.